Are you or loved one taking more than 5 medications every day? You're not alone. Millions of people, especially older folks, um, live with something called polypharmacy. But here the scary part is now one of the leading cause of hospitalization, side effects, even preventable death. Today, I'm going to explain what polypharmacy really means and why it's such a problem and smart precautions you and your family can take. So, what is polypharmacy? The term polypharmacy simply means many drugs. Generally, it refers to someone taking 5 or more medication every day. It's common in adult, older individuals and with multiple chronic medical conditions like diabetes, heart disease, COPD, arthritis, high blood pressure. It's not always bad, but sometimes necessary. But more medication you take, the higher the risk, right? So, why is polypharmacy a problem? Drug to drug interactions. Medication can clash, changing effectiveness or causing dangerous side effect. Example, somebody may be on blood thinners and painkillers, and there's a higher risk of severe bleeding. Overlapping side effects. Two different drugs might both cause dizziness that increases high fall risk. Medication cascade, a side effect of one drug gets mistaken for a new illness. More medications are prescribed unnecessarily. Example, water pill causes leg cramps. Doctor prescribes another pill instead of adjusting the first medication, right? Um, for example, somebody is taking amlodipine that causes leg swelling, then doctor would prescribe furosemide to reduce the swelling, and that will cause potassium loss. Then doctor is going to add potassium pill as well. And there's a way around it where you don't prescribe amlodipine in those patients who is causing severe edema, or lower the dose of that medication. Usually 5 milligram is more tolerable than 10 milligram. Or change the blood pressure medications so that there is no edema, there's no need for Lasix, there's no need for potassium supplement. Adherence issue. Complex schedule lead to missed doses or double dosing and causes lots of confusion among patients. Sometimes they just take the pills, they don't even know what they're taking, why they're taking. And there's a so I usually advise my patient to bring their medications, all the bottles of the medication in a bag, so that my staff will review them. Hospitalization. Studies show that polypharmacy is linked to higher ER visit, false confusion, and kidney or liver problems. How big is this problem? Nearly 40% of adults over 65 take 5 or more medication daily, and about 20% of them take 10 or more. I had a patient recently who was taking 17 medication. I mean, I took a picture, but I can't just show that picture to you guys. 17 medication, and I cut it down to 9. Polypharmacy is now considered a public health issue worldwide. It's costing billions of dollars in avoidable hospitalization and nursing home admissions. So, real life example, a patient on diabetes medication, blood pressure pills, cholesterol drugs, painkillers, and sleeping pills, and add over the counter supplements, and suddenly they are on 12 different substances. Result confusion, dizziness, fall, and ER visit. Family thinks dementia is starting, but in reality, it's medication overload. Prescription and what you can do. Medication review. At least once a year, ask your doctor or pharmacist to review all your medication, including over the counter medication and supplements. Deprescribing. Sometimes stopping a medication is safer than starting a new one. And your doctor can definitely help taper unnecessary drugs. Simplify regimens. Use combination pills or adjust timing to reduce pill burden. So there are medication that can be used for prostate and blood pressure. There are medication that can be used for blood pressure and anxiety. One medication can take care of that. There are medication with, dual therapeutic effect. So your doctor should know that. Ask 3 questions before any prescription. Do I really need it? What are the risk and benefit? Is there lifestyle changes alternative? Watch for red flag, new confusion, fall, dizziness, appetite loss. Often a side effect, not a disease. Keep a list, carry an updated list of polymedication and supplements to every doctor visit. And sometimes doctors, patient is seeing several specialists, and they make changes, and patient may not be able to communicate with the primary care doctor, and patient may see other specialists, lung doctor or sleep doctor, or saying that there's a many instances where there's a potential risk of new prescription or prescription being taken off. So reviewing medication in every visit is important, and that's what I do here. Polypharmacy does not mean your life has to be complicated with pills. The key is awareness, open communication with your doctor, bringing your medication, asking the question, why I'm taking this medicine, why I'm taking that medicine, and asking doctor, but smart choices about what you really need. Sometimes less is more when it comes to medicine. Take charge, ask question, keep your health simple and safe. If you found this helpful, share it with your parents, grandparents, friends. Do not forget to like, subscribe, and also if you have a question about your medication, drop them in the comments. I read them on a daily basis, and I will respond to you as soon as possible. Thank you.